Did you know that during the COVID-19 pandemic, India's very first lockdown happened within 4 hours of its announcement? Can you imagine what that does to the trust of the people towards its authorities? Hi, I'm Nandini Sarkar, and I'm a health psychologist. For the last decade, I've been working on health systems research in low and middle income contexts. But as a psychologist, what always comes back to me is humans and human behavior specifically. So today we're going to be talking about trust. Why do we trust and why don't we trust public health interventions or advice coming from professionals? Several studies have shown that when patients have higher trust in their healthcare providers, that they end up reporting more beneficial health behaviors, less symptoms, a higher quality of life. So it makes sense to always trust the experts, right? Unfortunately, that's not always the case. Firstly, trust and compliance are largely dependent on our underlying belief systems. So for example, if we believe in science, we are more likely to comply with scientific recommendations and advice. For example, during the COVID-19 pandemic, a greater belief in science led to more mask-wearing behavior. Secondly, trust is largely political as well as cultural. Oftentimes, a lack of compliance during emergencies can be attributed to individual mistrust. However, resistance to such interventions is often found clustered in entire communities, especially in ethnically and culturally diverse societies. For example, during the COVID-19 pandemic, to improve citywide compliance of various public health interventions in Antwerp, ITM researchers were working with local leaders of various minority groups, essentially providing them all the information they needed at hand. So if not the experts, who do we take advice from? We tend to take advice from our family and friends because we instinctively trust them. They know us, they know our personal values, our preferences. They essentially speak our language. We also turn to the internet. Many people across the globe have used the internet to access health information. Let's be real, most of us have probably played Dr. Google before. During the Ebola outbreak in 2015, we learned many things about trust and mistrust. In West Africa, like many cultures around the world, proper mourning and burial practices are key to ensuring a dignified passage of our loved ones into death. Due to the contagious nature of the Ebola virus, these practices were initially halted. However, the communities didn't react well to this. Of course, you're taking away cultural norms from them. Together with social scientists, medical anthropologists, and the communities themselves, new ways of thinking around these practices had to be sought. So interventions were adjusted, and safe burial practices, dignified burial practices, were once again resumed. Going back to COVID-19, one of the interventions that was put into place was wearing face masks. Some Asian countries have a long history and knowledge of wearing face masks for public health. In contrast, during the pandemic, there were many countries around the world where wearing face masks was a first-time measure. They'd never encountered it before. It was a very novel intervention being put to test. In these countries, because of the novelty of this intervention, many more efforts had to be put into place to ensure that the general public had better sensitization, more awareness building around why there was a need to wear this face mask and to ensure better compliance with it. Keeping these examples in mind, what are the key drivers to ensuring that public health interventions for outbreaks are effectively a success? Several things come to mind. For instance, we need to ensure that there are social scientists, such as psychologists or anthropologists, involved in the response itself, and that's from the very beginning of the response. We also need to ensure that we recruit local staff within the response structures itself. We can also, of course, ensure that we're involving grassroots leaders in the implementation and rollout of our measures. And of course, finally, we need to really ensure that the affected communities or provided the dignity and the empathy that they deserve. We at ITM study many different aspects of disease and care. We try to understand how diseases leap from animals to humans, or where pathogens hide when they're not infecting humans. And finally, how surveillance helps us keep an eye out on dangerous diseases. Want to learn more about how trust and behavior affect our health? Listen to our podcast.